So, Professor, tell us, what is the burden of depression in workplaces?
We know that depression is now, in the Western world, the largest disease burden of all. It creates more disability-related loss of life years than any other disorder, whether mental or bodily. What we have learnt recently is that a lot of that burden applies in the workplace. And in fact, we've developed a new term now. We call it presenteeism. Typically in the past, people have had depression, they've been off work, and they've been treated and they've come back to work. But we now realize that for many people, depression starts at the workplace. And when you're depressed at work, your performance falls. And that's now called presenteeism. So it's a failure to perform as a result of depression in the workplace. But presenteeism is not just a problem for the employer. It's not just a loss of productivity. Presenteeism is a major problem for the person who suffers depression, because most people want to do their best at work. And going to work and not being able to perform adequately puts extra pressure on the patient. That leads to greater stress, and that leads to more depression. And then eventually we may get to a state of burnout where people just can't work. And sometimes those people don't ever recover.
Mm-hmm. What is functional depression?
So one of the terms we've been using to try to explain this problem of depression in the workplace is the term functional depression. It's the elements of depression which mean that you cannot function properly. So it's problems of concentration, of attention, of memory, those problems which aren't necessarily seen as the core symptoms of depression. Because typically you think depression is about low mood, feeling sad, sometimes feeling guilty, not enjoying things. But beyond that, and in most cases of depression, there are also problems with what we call cognitive function, and that's functional problems in depression.
What is the impact of cognition for the recovery?
One of the things we've learned over the last 10 years is that depression is a constellation of different problems. There are problems like low mood, there are problems like sleep disturbance and anxiety, but a major problem is the problem of concentration and attention, these so-called cognitive problems. And it turns out that these are the hardest to treat. They get better less than others. When you treat people, they take longer to get better. And often they're the problem that stop people going back to work or really re-engaging in the world, because the impairment of memory and concentration can mean that people can't read a book, can't even watch the TV for very long. So depression is the largest burden of ill health in the Western world. The costs of treating it are relatively low. We have a lot of good treatments which are relatively inexpensive. So the costs of not treating it are enormous because of the lost work productivity, the lost family benefits, and the suffering that it produces to the person who actually has depression. So depression is powerfully undertreated. We've estimated perhaps that over half of everyone who's got a treatable depression isn't getting treated at present. So the costs are enormous. We're talking about tens of billions of euros a year in Europe, probably in each country. Of course, you might ask, why is it that so many people with depression are not getting adequate treatment? And there are a number of reasons for that. Doctors are not good at diagnosing depression. They often say things, well, you know, if I'd lost my job, I'd be depressed too. Well, that's not the point. The point is the person is depressed. Just because you understand why someone's depressed doesn't mean you can ignore the illness. So we have that kind of old-fashioned approach to it all makes sense in terms of your life stress. But also depression presents in different ways. It can present with failure at work, it can present with sleep disturbance, it can present with problems of appetite, not just simply with low mood. And a lot of doctors aren't very good at understanding that. And of course, there's also the stigma that patients suffer. But people, traditionally, saying you were depressed was seen as a sign of weakness. And it's not. Actually, it's a sign of insight. But still, there's that stigma. If I said I was depressed, then I'm somehow failing to be the person I should be. So there's a kind of moral antagonism to depression, as with many other psychiatric problems. People want to see them as problems of will rather than real biological problems that they are.
Just one last question. You shortly mentioned this with loss of productivity. So there must be a huge cost for private corporations all over the world.
So when people are depressed and they are going to work and they have this problem of presenteeism when they're not working as efficiently as they can, this produces quite a big burden on their employers. It's been estimated in America that the cost of presenteeism is about $60 billion a year. That's an enormous cost. And much of that is remediable if people get appropriate treatment.